Grab your ball and come to lie supine. You'll hug one knee into your chest and taking it across the body, placing it on the ball. Make sure you're bracing your abs as you move into this deep twist for the lumbar. Arms are stretched out in a T, opening up the front of the shoulders. You're looking away from the knee, and we're breathing, contracting our transverse abdominis to support the spine twist. Inhale through your nose, pull the belly button in towards the spine, lift up on the muscles that stop your stream of pee, and fog a mirror with your exhale. Inhale through your nose, pull the belly button in towards your spine, bracing the abs. Exhale the air out. Your exhale should allow you to sink deeper into the twist. Try to keep your shoulders down your back, your sternum reaching towards your back body so you don't pop the ribs forward, disengaging in the core. One more breath here. Inhale through the nose, pull the navel in towards the spine, lift up on those muscles that stop your stream of pee, and fog a mirror with your exhale. Let's take it to the other side. Setting up, making sure to brace the abs as you move into this deep twist. You can always cushion the knee up higher with extra pillows or books, whatever elevation you need. Grab things in your house to bring that knee up to a comfortable position where you feel a nice release and stretch in the low back, but you're not feeling pain. If at any point you feel pain, make sure you're bracing and engaging the transverse abdominis, the deepest layer of your core. Inhale through the nose, pull the belly button in, brace the abdominals as if you're going to be punched in the gut, and exhale the air out. Inhale through the nose, pull the belly button in, hold it in, lift up on the muscles that stop your stream of pee. Hold the lift, sustain it as you fog a mirror with your exhale. We'll move out of this twist, bringing the ball under our pelvis to elevate it, making sure it's high enough that you can take your pointer fingers to the bony protrusions on the hips, the ASIS, and guide them down, creating lumbar extension with your abdomen pulled in and the lower pelvic floor muscles lifting up. So we're going to exhale, firming our abdominals to move into deep lumbar extension from the pelvis, and we'll inhale back to a neutral pelvis, guiding the ASIS, the bony protrusions of the hips, down and up, as if they were suspenders that you were loosening and tightening. Exhale down, bracing the abs. Inhale up to neutral. Exhale down, bracing the abs. Inhale back to neutral. Understanding the optimal pelvic position for you with flat back posture is important. Often we see a lot of chronic low back pain due to the excessive pelvic flexion position and overactivity in the calves and the hamstrings. We're going to counter that with some lumbar extension, which should alleviate the back pain and really open up the back of the legs, strengthening the front of the legs, the quads, and the hip flexors. From here, place both hands down by your side and float one leg up to tabletop. Knee should track right over the hip. The other foot, I want you to keep grounded on the floor. Reach the tailbone away from you, accentuating that lumbar extension. Allow the sternum to reach towards the spine, closing the front ribs. Plug the shoulders down the back. We're going to bicycle this single leg here. Inhale, prepare, abs brace. Exhale, bicycle the leg. Each time you run out of air, you pause wherever the leg is. You inhale through your nose, breathing laterally into the rib cage. Brace the abdominals and exhale the air out, beginning your bicycle again. Until you run out of air, then you inhale, brace the abs, lifting in and up on the muscles that stop your stream of pee, and circling that leg. Lots of energy, lots of length. Feel free to dorsiflex the foot as you do this. This will help combat the plantar flexion in the ankles. I'd prefer, if anything, you either keep the feet relaxed or dorsiflexed. Don't point the feet. We don't want to work in plantar flexion when that's a constant position that the forward leaning from flat back posture puts you in. Let's switch sides, using your abs to brace and lift the other leg up. Pause to inhale, move on your exhale. We're teaching the body that your exhale is your effort. That's where we're going to place the effort of all movement, and we're always going to support the movement with the contraction of the transverse abdominis, bracing those abs to keep the low back safe. From here, we're going to finish up our last set, put the foot down, lift the pelvis up, slide that ball out. We'll bring the ball under our shoulder blades, and we'll bring our lightest loop band around the arches of our feet, setting up for some rectus abdominis work with marching for your hip flexors. Support the head with the hands interlaced. Take an arch over, inhaling, pressing the back ribs into the ball as you lift one leg up. Let's start with your non-dominant leg lifting with the foot dorsiflexed, and then you lower the leg and the upper body as you inhale. Brace the abs, pressing the back ribs in as you lift up on your exhale, and lowering on the inhale. Brace and lift on the exhale, and lower on your inhale, keeping a nice steady tempo. Brace, lift, inhale, lower. Abs come in and up as you brace and lift. Inhale, lower. Switch your leg. Keep that breathing going, remembering the contractions happening as you lift up. Make sure your tailbone is reaching away from you, accentuating that lumbar extension, but you're always supporting that extension with the contraction of the transverse abdominis by pulling your belly button in and lifting up on the muscles that stop your stream of pee. Think about that lift, or think about bracing the abs as if you're going to be punched in the gut. We're going to move from here onto our knees on the foam roller with a 3-pound weight and the ball between the inner thighs to engage those adductors. We'll do a 2-breath isometric hold with lateral flexion. Start with the weight in your non-dominant hand, side bending towards that weight, keeping your torso square to the wall in front of you, chin retracted. Back of neck will be long. You can either turn your head to the side on the diagonal down or keep the chin retracted and the head between the arms, adding that bottom arm. Palms are facing one another. Ribs are closed, sternum reaching towards the back body. That should be about 2 breaths. Bring yourself back upright. Continue to work as I give you these cues. Your alignment and your checkpoints are super important for really feeling the correct muscles, for contracting your transverse abdominis, and for maximizing your workout. So as you side bend, you lift your bottom arm up, increasing the load. We're conditioning your external obliques here, opening up your intercostals. The side body is very tight with flat back posture. We want to open up the side body, but also strengthen the QL and the external obliques. Bringing it back up to center, switching sides, preparing, inhaling, going over to the side bend, exhale, adding the bottom arm. Inhale 1, breathe, exhale 1. Inhale 2, exhale 2, inhale back to center. Exhale the air out and preparing, inhale side bend, add the bottom arm, exhale. Inhale 1, breathe, exhale 1. Inhale 2, brace those abs, exhale 2, close those front ribs. Inhale, brace the abs and pull yourself back to center. From here, we'll grab our heaviest Theraband, coming to a seated position. Dorsiflex those feet. Place the ball between the knees and the heaviest Theraband around the arches of the feet, grabbing the band with both hands. We're going to hinge back with a tall spine, imagining a metal rod from the tailbone all the way out the crown of the head. No rounding in the lumbar, tailbone pulling down towards the floor, chin retracted so the back of the neck is long. As you hinge back, bracing the abs, you'll inhale, pull the arms into an isometric row, keeping the shoulders down the back, collarbone wide, turning the head right, center, left, center. Inhale, prepare, brace the abs, exhale, back upright. Again, inhale, sit tall, exhale, brace the abs, hinging back, rowing. Inhale, turn the head right, center, left, center. Inhale, brace the abs, and come back up to a tall seat. 2 more sets. Moving on your breath, making sure you brace your abs as you go back. You inhale to turn the head side to side, brace the abs, come back upright. Inhale, prepare, brace the abs, take it back. Inhale to turn the head side to side, holding that isometric row, and brace those abs, lifting in and up to come back up to a seated position. You can set that band to the side. Great work. We'll come to lie prone for some slow swimming, working the upper back extensors. Extending opposite arm and leg, making sure the bony protrusions of the hips are pressing down into the floor and the low abs are lifting in and up towards the spine. Lift opposite arm and leg up. Hold it up. Inhale 1, breathe. Exhale 1. Inhale, brace the abs, and exhale, lower that down. Staying on this side, inhale, brace the abs, exhale, lift, hold, inhale, brace the abs, exhale, lower. Inhale, prepare, abs in, lift in and up on the muscles that stop your stream of pee, fog of air as you lift up. Palms should be facing in towards the face, inhale, brace those abs, fog of air as you lower down. Still on the same side, inhale, brace the abs. Exhale to lift. Inhale. Brace the abs. Exhale to lower. Go ahead and switch sides. Be cognizant of those bony protrusions. The pelvis should be completely stable here. Think more about length than height as you lift up. Make sure the shoulders are staying on the back. Collarbone is wide. Back of neck is long. Chin is retracted. Optimal alignment here, thinking about the sternum reaching towards the back body. Even though it's on the floor, make sure you're not pushing those front ribs into the floor, that you're thinking about them pulling in towards the back body. As the belly button is pulling in towards the spine, we lift in and up on the muscles that stop our stream of pee, and the air comes out of the mouth. Inhale through your nose to prepare. Brace the abdominals to lift the upper back up, engaging the upper back extensors to combat kyphosis. Inhaling and controlling your lower. One more here. Inhale. Abs in. Contract. And lower on your next exhale. Take a quick swish of your hips side to side to release the low back. And then anchor those bony protrusions on your hips back down into the floor. Pull the belly button back in towards the spine. Inhale, lifting all limbs up. Exhale to flutter the arms and legs. Flutter, 2, 3, 4. Inhale, 2, 3, 4. Flutter, 2, 3, 4. Staying up. Inhale, 2, 3, 4. Flutter. Go as quickly as you can with length, not worrying about the height, worrying about the brace of the abdominals, the sternum reaching towards the back body, the rib cage expanding sideways like an opera singer, lateral breathing, lots of length, pelvic stability, chin retracted, focus of the eyes, 1.5 feet in front of you, plugging the shoulders down the back. 2 more breaths. Inhale, 2, 3, 4, and exhale, 2, 3, 4. Last breath. Inhale, 2, 3, 4, and lower with control, 2, 3, 4. We'll grab our 3-pound weight, come to a side lying position. You can be in a fetal position, placing the ball under your head as a support. Pin that top elbow on the side of your body, and make sure as you're holding that weight, your wrist is flat. We'll lift up on our exhale, and we'll lower on our inhale. Exhale, lift, 2, 3. Inhale, lower, 2, 3. Exhale, lift, 2, 3. Inhale, lower, 2, 3. Staying with this tempo, watching out for the elbow detaching from the side of the body, the wrists staying completely flat, the rib cage staying closed, sternum reaching towards the spine, belly button pulling in towards the spine, deep lift of the lower abdominals, shoulders plugged down the back, collarbone is wide. Stay with this. Make sure you're also not collapsing into the side of the body that's down on the floor. Energy through the tailbone for some lumbar extension here. Tailbone reaching towards your feet, towards whatever wall is below you. Breathe, breathe, breathe. 2 more sets here. Bracing the abs to lift, 2, 3. Breathing laterally to lower, 2, 3. Again, pull the abs in, lift in and up. Keep the shoulder plugged down, collarbone wide, ribs closed. Inhale, lower, 2, 3. Setting up on the other side. Finding the tailbone reaching away from the body and slightly back for lumbar extension, the abs braced. And begin, once you are set up with your shoulders plugged down your back, collarbone wide, sternum reaching towards the back ribs. Exhale, bracing the abs to lift up, 2, 3. Inhale, lowering, 2, 3. This is a small movement. We're isolating the external rotator cuff. This should help combat the kyphosis that we see with flat back posture. Something to be aware of if you're feeling pain in the front of the shoulder, that can be for 2 reasons. 1, you're not squeezing the back muscles enough, or you're rounding in the front of the shoulder. The weight could be too heavy. If that's the case, you could do this just with body weight, or grab a can or something that's around 1 or 2 pounds. We'll also work on flexibility in the front of the shoulder. And once your anterior delt releases a bit, you should have less recruitment in the front of the shoulder and be able to access the external rotator cuff. From here, we're going to grab our heaviest band and we're going to put it around, we're going to place it around our top foot, coming into a side lying position. We'll be doing forward, forward, back, back, dorsiflexing the foot for an active hamstring stretch with the support of the band, holding it with your top arm. So you can rest your head down on that ball or the bicep here as we kick it forward, forward, and back, back, dorsiflexing the foot the entire time to combat the plantar flexion in the ankles and really, really open the hamstrings and calves that are overactive. So forward, forward, back, back, forward, forward, back, back, forward, forward, back, back. Keep that going. The goal here is to not move the trunk too much. Make sure you're not rocking back and forth, that you're stabilizing your torso by engaging the deepest layer of your core. One more time, forward, forward, back, back. Go ahead and we're going to switch sides, setting up for the leg work on the other side. This work is meant to also work the abdominals and actively stretch the hamstrings and combat the plantar flexion in the ankle. Keep going forward, forward, back, back, working for pelvic stability. Sometimes it's nice to bend that bottom knee into a fetal position because it gives you more leverage, but make sure when you do that, you don't round your low back, that you're still reaching the tailbone away from you, keeping lumbar extension with the brace of the abdominals. Continue with that dorsiflexion of the foot. Make sure the foot is flexing evenly. The band will help with this, and this heavy band will give you a little more support as you learn to move the leg through space without moving the torso, isolating just the leg. One more, forward, forward, back, back. We'll set the band down, grab our 3-pound weight, bring our knees onto the roller. Holding the weight in one hand and extending the opposite leg behind us. We'll pull that weight towards the hip on a 3 count, lifting it up, 2, 3, bringing it back down on our inhale, 2, 3. Exhale, lift, 2, 3. Notice I'm isometrically holding the leg behind me. Make sure the foot is dorsiflexed. Make sure your pelvis is square. The bony protrusions of the hips are pointing towards the floor. The toes of the knee that's down are down as well for stability. Your knee is tracking under your hip. Your wrist that's down is tracking under your shoulder. And we're working our lats here as we pull the arm back. So again, bracing the abs to lift, inhaling to lower. Keep your collarbone wide, the sternum reaching towards the back ribs. If the neck is straining, think about relaxation in the pecs and retraction of the chin. Give me a double chin to engage the muscles in the front of the neck to alleviate the tension in the back of the neck. Keeping that arm going, really working on that transverse abdominis, the dorsiflexion of the foot to combat plantar flexion in the ankle. Let's switch sides, passing the weight, extending the opposite leg, making sure the toes of the knee that's down are down as well. Watch out for hiking in the hips. Make sure one hip isn't higher than the other. Working on getting as even as possible. Brace those abs as you pull back. The palm should be facing in towards the hips. Shoulders plugged down the back, collarbone wide, abs lifting in and up. Every time that weight goes back, sternum reaches towards the back ribs, belly button pulls in towards the spine, and you fog a mirror as you brace your abs as if you're going to be punched in the gut. 2 more sets. Lifting up, 2, 3. Inhale down, 2, 3. Pull the abs in, lift in and up, and lift, 2, 3. Inhale, lower, 2, 3. Good job. We're going to grab our heaviest Theraband and our anti-burst ball. Coming to lie supine with the ball under the sacrum. Make sure, take your pointer fingers to the bony protrusions of the hips, guide them down, allowing your pelvis to droop over the ball so that you have lumbar extension. Brace your abs and take one leg in the air. Hooking the heavy Theraband around the foot, really dorsiflexing the foot to combat the plantar flexion in your ankles. We'll hold it here. Challenge yourself to reach the tailbone away from you, keeping lumbar extension, and to try to squeeze the front of the thigh to lift the kneecap so that you maximize the stretch in the hamstrings and calves here as we do our footwork. The feet are really important. We want to balance the feet and ankles in an effort to change the distribution of weight so there's not so much overactivity in the hamstrings and in the calves, and we can learn to use both the quads and the hip flexors more efficiently, balancing out the body. 15 more seconds here. Notice if you're flexing harder with the outer or inner edge of the foot, even that flexion of the foot, toes reaching towards the face, sternum reaching towards the back ribs. Go ahead and set up on the other side, making sure that you have one hand down at all times for balance purposes, that you're still reaching the tailbone away from you so that we don't get that rounding in the low back. That's a position we're in too often. The reason we elevate the pelvis is to allow it to droop over and to allow more curvature in the low back. This should feel great if you have chronic back pain, as long as you are bracing your abs as you're working. So as long as when you pull that leg towards you, the tailbone reaches away into extension and the abs pull in and up as if you're stopping your stream of pee. So active abs, proper pelvic position, dorsiflex that foot, check in with your breath. Inhale through the nose, breathing laterally into the rib cage. Pull the belly button in, lift up on those muscles that stop your stream of pee. Hold this lift, sustaining it through your exhale. Again, inhale through the nose, pull the belly button in towards the spine, lift up on the muscles that stop your stream of pee. Brace, sustain, exhale. We'll come to a seated position, placing the ball between the knees, grabbing our heavy Theraband, placing it around the feet, moving into some bow and arrow twisting to work your transverse abdominis, your hip flexors, your adductors, and combating the plantar flexion in the ankles. We'll hinge back with a tall spine, and we'll twist 2, 3, 4. Inhale, prepare, brace the abs, come back upright. Inhale, prepare, brace the abs, take it back, and twist 2, 3, 4. Inhale, prepare, brace the abs. Exhale, bring the body back upright. Continuing with this tempo, breathing in at the top, bracing the abs to hinge back, and twisting 2, 3, 4. Inhale, pause, brace the abs. Exhale, come back upright. Some checkpoints as you continue working. Are the inner thighs engaging? Are your feet staying flexed? Are your heels driving into the floor? Is there a line from the tailbone out the crown of the head? A nice diagonal. Are you reaching the tailbone towards the floor, creating some more extension in the low back like you found when you were lying on that anti-burst ball? Are your abs pulling in towards the spine to support the twisting? One arm should be coming forward as the other goes back. The head follows, turning in the direction of the elbow that's brushing by the side body and going back. Finish up your last one. We'll set that band to the side. Coming to lie supine on our foam roller, arms in cactus. This position can feel rather hard on the back with flat back posture, so I want you to take a moment to adjust to the spine being on the roller. From here, with the arms in cactus, opening up the front of the shoulders and the pecs. I want you to arch your low back, trying to create a mouse hole between the low back and the roller. This pelvic extension is what I want you to do your best to maintain as we work your quadriceps here. So what I'd like you to do is bring your hands down by your side for stability and stretch one leg out long. You're going to flex that foot and we're going to lift it up on a slow 3 count, taking it up to, not going to 90, going to about 70, squeezing the front of the thigh and lowering it down. 2, 3. Try to not wobble on the roller. Keep the roller still by lifting in and up on your abs. So exhale, lift, 2, 3. Inhale, lower, 2, 3. This is about core stability and quadricep strength. So focus on not moving that roller, keeping the sternum reaching towards the back ribs, the belly reaching in towards the spine, the pelvic floor muscles lifting in and up. Excellent. From here, switch sides, setting up for that quad single leg lift on the other side. Remind yourself the tailbone should be reaching away from you, down towards your heels, allowing some extension in the low back. I should be able to slide my hand between your low back and the roller. Try to not squash my fingers. Keep that space by tipping the tailbone down as if it were hanging over that anti-burst ball. Brace the abdominals. Dorsiflex the foot as you lift and lower. Remembering this is not about getting it up to 90. This is all about squeezing the front of the thigh and working the foot, keeping it in a nice dorsiflexed position. Give me 2 more on this side. Using the breath, bracing, exhale to lift, inhale to lower. Always feel welcome to slow down an exercise and only move on your exhale, meaning at the top you inhale again, you brace the abs, and you go down on your exhale, slowing it down even more to make sure the core is always connected to the movement to support it. From here, let's slide the other leg out, and this time we'll internally rotate it, keeping the dorsiflexion. This will allow us to access not only the quads, but the hip flexors, and open up the lateral hamstrings a little bit more. So again, it's not about height, it's about squeezing the front of the thigh, keeping the foot dorsiflexed, and keeping that internal rotation, not from the knee or ankle, but from the top of the hip socket. As you lift up, you count to 3. As you lower down to 3. So let's say you wanted to go only on your exhale because you do have chronic back pain and you're very worried about moving on your inhale when you're not bracing your abs. That would mean at the bottom, we'd inhale, prepare, reach the tailbone away, creating that mouse hole, brace the abs, lift the leg up, 2, 3, hold it up, inhale, pull the abs in, brace them, and lower down, 2, 3. Let's switch sides, moving into our lift for the quads and hip flexors. On the other side, internally rotating the leg in the hip socket, making sure to reach the tailbone away towards the heels, down, creating that lumbar extension. Dorsiflex the foot as we lift it up. 2, 3, we inhale at the top, bracing the abs. Exhale, lower, 2, 3. Pause at the bottom, inhale, reach the tailbone towards the heels, brace the abs, lift up, 2, 3. Pause at the top, breathing laterally, inhale. Keep the roller quiet, brace the abs. Exhale, lower, 2, 3. Great job. From here, let's do a few sets of pelvic extension to neutral, just to release that back. We'll come off of the roller, grab our ball, place it back under our tailbone, and we'll move our pelvis, taking our pointer fingers to the bony protrusions of the hips, down, drooping over the ball, and back to neutral. Exhale down, supporting it with the contraction of the core on your exhale. Inhale, breathing laterally, sternum reaching towards the back body. Exhale, arch the back. Inhale, neutral. Exhale, arch. Inhale, neutral. Exhale, arch. Inhale, neutral. And last time, exhale, arch. inhale, neutral. Good job.